Hi everybody, this is Dr. Sridhar Venamaneni at Pratima Hospital in Kukut. The current influenza infection H3N2 and also talk about the latest COVID spike in India. I'm sure you all have heard about the H3N2 infection, which has been spreading around India the last few months. Close to 7 to 8 people have died from complications of influenza. The H3N2 infection is typically it's a viral infection. Normally it is confined to pigs, and when these pigs sneeze or cough, humans get infected through the droplets. And once a person is exposed to these droplets, within 1 to 4 days they can get infected. So any person who is feeling sick, has high fever, muscle aches, joint pains, cold cough with high fever, if you have those symptoms, you most likely have influenza, the H3N2 type. Once somebody is exposed to these droplets, they typically start developing symptoms within 1 to 4 days. And most patients typically have high fever with cough. They can have a running nose. They can have extreme fatigue, muscle aches, chills, nausea, vomiting, loose motions. And then if these symptoms worsen, they can develop pneumonia where they can become short of breath, they can have chest pain, palpitations. So it's extremely important that if you have any of these initial symptoms of fever, cold, cough, you don't ignore these symptoms. Now, once you develop these symptoms, it's very important that you see your doctor immediately, because there is treatment available to immediately suppress this infection. The treatment has to be given. There is a class of antiviral drugs that can be given, which should be given ideally within the first 2 days. If we start this treatment within the first 2 days, there's a very high likelihood of the treatment being working much better, and you'll feel fever will subside within a day or two, and your symptoms will improve quickly. The risk of complications like pneumonia, dehydration will be significantly reduced if you start treatment in the first 2 days. Now, what does somebody who has these symptoms, what do they have to do to prevent the spread? The prevention is similar to what we advise our COVID patients. You need to wear a mask, you need to stay at home, you need to drink a lot of fluids, use a lot of sanitizer so that the surfaces that you're in contact with are not infected. And your family members should all be wearing masks and should stay away from an infected patient for at least 5 days. And how do we prevent this infection in general? Prevention, the most important key is to wear a mask and stay away from anybody who has fever, cold, cough, or anybody who's starting to feel sick, anybody who has extreme fatigue and muscle aches. These are all could be symptoms of the beginning of a viral infection. So the most important thing is to wear a mask, use the sanitizer, and stay away from infected patients as much as possible. Now, in fact, if you are exposed to a patient who has active infection, for that matter, there is still a treatment. The same drug that we use to treat acute infection can be also used to prevent an infection. So if you have a family member with active flu, let's say has high fever and suspected flu, if you are asymptomatic, you can still take the same drug, but instead of twice a day regimen, you take once a day. Typically, your physician should be able to advise you on that, and you do that for 5 days. It's a once a day tablet to prevent you from getting infected. So I went through the normal course of if you look at the normal course of infection, typically patients can have fever for up to 3 to 4 days. They can have extreme weakness, which can last for 10 days or more. They can have loss of appetite. Cough can linger even after can linger for even 2 to 3 weeks or even 4 for sometimes. So the course of most patients will have fever for up to 3 to 4 days. But if you start treatment immediately, fever will subside within a day or two. What are the serious complications that we are concerned about? Number one is pneumonia, where Once you develop pneumonia, you'll be really short of breath, your oxygen levels could be dropping, you'll be having palpitations, you'll be sweating, and usually heart rate could be going up. So it's very important that you monitor your heart rate and your oxygen levels closely, because if your oxygen levels are dropping less than 92%, that's a sign that you may be developing pneumonia and then you need to be in the hospital. For these patients, we start them on IV fluids, some nebulizer treatments, some antiviral treatments, plus or minus antibacterials. The patients that are at high risk for pneumonia are patients who are pregnant, patients who are above 65, patients with diabetes, patients with heart disease, kidney disease, liver disease, patients who are smokers with asthma, COPD, and also small children less than 5 years. So all these are people who have a higher risk of serious complications like pneumonia and dehydration. I also want to give you a brief update on the current COVID spike that is being reported in this country. We're seeing, especially in Kerala, the cases have been going up, and the COVID symptoms are pretty much similar to flu symptoms. Patients will have similar high fever, chills, cold, cough, muscle aches, joint pains. They can have vomiting, diarrhea, in addition to loss of taste and smell. And COVID symptoms can also quickly develop within 2 to 3 days after exposure to a patient. So symptoms are pretty similar. So if you have high fever, cold, cough, it's very important that we see you, and we can test you for there's a RT-PCR for influenza. There's also RT-PCR for COVID. So there's a way to test and target treatment for either infection. Thank you. If you have any questions, I'll be ready to answer them. Target treatment for either infection. Thank you. So the first question is how to diagnose H3N2. In addition to, there's just like COVID test, there's a nasal swab. There's a swab that can be sent to the laboratory, and it's a RT-PCR test for H3N2 for influenza, which will tell us whether it is influenza or something, or if it's positive for influenza, it will tell us if it's influenza A or B. And so the nasal swab is a way to go, just like a COVID test. This is another nasal swab test, which will tell us what kind of infection you have. The next question is about a patient whose son is suffering with cold and fever for the last 1 week, which hasn't gotten better, and the question is, what do we do? Now typically, if you have persistent cold and fever, the most important thing is you have to make sure there's no signs of any pneumonia, because this sounds like typical cold and fever viral infections. By now the fever should have subsided. The fact that the fever is still persistent after 1 week is a sign that it could be a bacterial infection, it could be a pneumonia, it could be something else. So it's very important. You may need an X-ray, you may need a blood test. So it's very important that you get tested. A blood test and a chest X-ray is the next step, and you may need to be started on, the child may need to be started on antibiotics, because typically viral infections, patients don't have fever more than 3 to 4 days. So if you've had fever, if the patient had fever for 5 days, it could be an infection in the sinuses, it could be infection in the lungs, so you need to be tested. Now, the next question is if sore throat is a sign of H3N2 infection. It can be a sign of infection because sometimes patients can have the initial symptoms could be just a sore throat, but sore throat could also be other viruses. You have a virus called rhinovirus, there's another virus called adenovirus, there's another virus called RSV, and then you have a bacterial infection called strep infection. There's also another infection called mononucleosis. All these are different infections where you can have a sore throat. But now, as of now, if somebody has a sore throat, we have to examine the patient to see if there's any signs of this strep infection, a streptococcal bacterial infection. If there's no signs of that, then we assume it's a viral infection. So it could be other viruses, it could be H3N2, but unless you have high fever with sore throat, then it could be other infections. The next question is about a patient whose father has had COVID infection. What is the chance of a H3N2 attack? There's no, the chance is really low as long as your father is wearing a mask and is staying away from crowded places, because typically this infection is spread through droplets. If somebody is coughing around you or sneezing around you, and the patient has an infection, or if he's in the early stage of infection, so that's how you get it. Just like COVID, the spread is through droplets and contact. So as much as possible, your father should be wearing a mask when he's going out, and he should avoid crowded places, restaurants, parties and stuff like where you have functions where there are a lot of people. Better to wear a mask and use a lot of sanitizer. Avoid shaking hands with people and then touching your face. Those are the things that you want to prevent. That's a way to prevent. The chance is low as long as you stay away from people. If you're around people, there's a high risk. And if you have high fever with sore throat, muscle aches, joint pains, cold and cough, then most likely it's H3N2 infection. The next question is, I have dry cough for more than 10 days. What do I have to do? Dry cough, typically the most common cause of dry cough is either allergies, like allergies to dust, pollen, weeds, grass. At home you have curtains which could be full of dust, and then the sinuses. The most common cause of cough is usually like if you have dripping from the sinuses, if your nose is congested, or silent nasal dripping can give you dry cough. The other thing is some patients can have acid reflux, acid coming from your stomach all the way into the throat, especially when you're lying down at night, can irritate the throat, and you can have dry cough from that. By the way, if you've had dry cough for more than, for this long, it's good to be examined. Examine your lungs, examine your throat, see if it's coming from your sinuses or your lungs. Sometimes even asthma patients, you could have patients with asthma who can just be coughing. They don't need to have shortness of breath, they don't need to have wheezing, they could just have a dry cough. So it's imperative that you get examined by a physician, and the most common causes are allergies with sinus, nasal dripping. Number 2 is acid reflux, number 3 is asthma. So those are the things that we treat, one after another. The next question is H3N2 dangerous? It is dangerous for some patients, though, especially if you have, like I said, if you're above 65, if you're pregnant, if you have heart disease, lung disease, if you have a kidney problem, if you have liver problem, all these are patients, or if you're a cancer patient on chemotherapy, these are all patients at high risk of infection. And it can be dangerous if you develop, let's say, severe pneumonia. In fact, I have one of my friend's father recently passed away from complication of H3N2 infection. He was in Bangalore, had pneumonia, respiratory failure, he was on a ventilator for 10 days and required tracheostomy, and after that he developed a heart attack and could not make it. So it is dangerous because it can make you sick to the point that your other issues can become an issue. In other words, you develop a pneumonia, and then if pneumonia is severe, then other systems will shut down. Your kidneys may shut down, your lungs will get severely damaged, you may need to be on high dose of oxygen. So it can be dangerous for some patients. So it's very important that you don't ignore high fever with cough. You need to be tested and treated. The next question is about vaccines, if they're available for H3N2. There's no specific vaccine for H3N2, but typically we have seasonal yearly. There's a vaccine against influenza, which is pretty effective. It's effective about 60% of patients. It works in 60%. So if you were to take the vaccine sometime in October or November, the vaccine is effective until March, April. So there is a seasonal, it's called the influenza vaccine, and every year the virus changes, so the vaccine changes every year. So if you get the vaccine, let's say sometime in October or November, that will be effective for next 6 months to 8 months. So for this season, you should have had the vaccine sometime in October or November last year. So there is a vaccine available, and so usually we recommend it in America. We recommend it for everybody. It's covered by insurance. So here, all patients who are at high risk, if you're pregnant, if you're a patient above 65, you have diabetes, heart disease, all these patients can get the vaccine. It might cost 1 or 2,000, but it's worth the money because it will prevent a serious infection. The next question about what age groups are more prone to the virus. It's mostly younger kids, kids less than 5 years, and adults above 65, and also patients who are pregnant. These are patients who are higher risk of infection. What additional precautions should be taken care by diabetic patients? The precautions are the same for diabetics also, because diabetics have a higher risk of serious pneumonia and respiratory failure. They have to be careful with any, one, they have to stay away from patients who are sick. If you have a family member who is sick, you wear a mask, use a sanitizer, make them stay in a room for 5 days, and not get in contact with them. Let's say you're in contact with these patients, then and if there's a suspected flu case or influenza case, then you can start the antiviral treatment, which will prevent you from getting infection. The other precaution is, like I said, drink a lot of fluids, rest. You need to have good rest, especially at night, 7 to 8 hours of sleep, and using a sanitizer, wearing a mask. Those are all the precautions for everybody. The next question is, what are the similarities between COVID and H3N2? Similarities are, the symptoms are similar. Patients can have both infections. You could have high fever, you could have sore throat, chills, muscle aches, joint pains. You can have some gastrointestinal symptoms like vomiting, diarrhea. All these are similar. The only difference is in COVID, typically, some patients can have loss of taste and smell, which we don't see in H3N2. The rest of the symptoms, the fatigue, the cough, all those are similar. Mostly you'll have a dry cough, you can have some running nose, you can develop pneumonia with COVID, just like H3N2. So the similarities are fever, cold, cough, pneumonia, all these are similar. The only difference is you'll have mild loss of taste or smell in COVID, unlike in flu. The next question is about, do we need to take any additional precautions for food, and what are the best foods to take? Now, typically for any infection, to prevent any infection, we always recommend a few things. One is exercise is always good for prevention, and diet-wise, you want to eat more vegetables, more fruit, stay away from too much oily foods, foods with too much sugar, like sweets and cakes and cookies and pizza and all those kind of food with too much carbohydrates, because all infections like viruses, bacteria, all of them, they like too much sugar. So you want to reduce the amount of sugar intake. So whether it is eating a sweet, or if you're using too much sugar in your coffee or milk, you want to reduce that. So you want to do more fruits, vegetables, nuts. You can obviously take your multivitamins. Those are all good for you. The foods to avoid are mostly fatty foods, fried foods, and too much sugary foods. Whether it's sugary drinks, juices that are ready-made, store-bought, I would stay away from them. You can have a juice that if you make it from fresh fruits, juices are fine. But anything store-bought, there's a lot of sugar added, so I would stay away from them. So, but my advice is more fruits and vegetables. Stay away from oily foods, fatty foods, and sugary foods. The next question about probiotics, can they increase the immunity power? The studies show that probiotics are mostly useful for patients who are on antibiotics or patients with diarrhea. If you've been on a course of antibiotics, now these antibiotics will kill the good bacteria in your stomach, which in turn can predispose you to stomach infections and overall in general more inflammation. So probiotics are good if you have any stomach issues like diarrhea, colitis, inflammation in the colon with multiple loose bowel movements, abdominal pain, a lot of bloating and gas. These are patients who will benefit from probiotics. But for COVID and H3N2, I don't think there's any evidence about role of probiotics. The next question is about home remedies to prevent or protect from this virus. The home remedies are number one, to sanitize all your door handles, and wherever there is somebody who's infected at home, if somebody has an active fever, cold, cough at home, it's better to stay away from them, wear a mask, use your multivitamins like Zinc-Ovate or A2ZN as one of those multivitamin daily, and wearing a mask is the most important thing. The other remedies are, in general, to prevent any infection, you have to exercise 30 to 45 minutes daily. You have to have 7 to 8 hours of sleep at night, and you need to have less stress, because all these things, stress, lack of sleep, lack of exercise, eating unhealthy foods, all these will increase inflammation, which in turn can increase the risk of infection. So you want to eat more vegetables, more fruits, stay away from fried foods and unhealthy foods. Is there any medication? The next question is about any medication to take before the virus is active. The answer is yes. There is a medication, the brand names, there is a brand name called Fluware, there is another one called Tamiflu. These are medicines that can be used if you have any fever or cough, and if you're in the process of, if you already are exposed to somebody and there's a suspicion for you being exposed to an active patient with active flu, then these medicines will prevent you from getting infected. So the answer is yes, there is a medication, but since it's a controlled substance, typically pharmacies won't give you the prescription without a prescription. You can't get it from the pharmacy directly. You need a prescription from the physician, because it's a medication that is controlled by the government. The next question is about black tea. Is it good for immunity boost? The answer is there are studies that show, especially tea and green tea especially, has been shown to have some antioxidant properties, and there are some studies to show there's nothing wrong with drinking black tea. You can have 1 or 2 cups a day, there's nothing wrong, but green tea has more good studies to back up immunity. The last question is, do we need to wear mask when going out to protect from this virus? The answer is yes. The advantage of wearing a mask is not only against this virus, even COVID virus or other viruses. There are other viruses, one virus called rhinovirus, where you could just have low-grade fever, cold and cough, a lot of running nose, nose congestion for like days, you're just sneezing and blowing your nose a lot. All these are viruses that are transmitted by people coughing and sneezing around you. So you definitely, wearing a mask will prevent all kinds of viruses. So especially if you're leaving your house, wear a mask, and that'll prevent you from getting these infections. The next question is about vaccination. Is the vaccine an effective way to protect myself from influenza? The answer is yes. It does work in 60% of patients. It's not a 100% effective vaccine, just like your COVID vaccines, but it does prevent serious pneumonia. It prevents serious infection. Even if you were to get the infection, you'll have a mild case of infection. So vaccination is a good way to prevent influenza. The next question is, does this year's vaccine cover all the viruses that are currently circulating? The answer is, at this stage, the vaccine that is currently available was made last year, because it takes time for these drug companies to make the vaccines. And the way it works is, they make the vaccines about 3 to 4 months ahead of the infection. So the vaccine that we have now, the vaccines were made based on the viruses that we had all over the world sometime in April, May last year. So the current vaccines that they will make now will be made sometime in the next few months based on what all viruses are going around in Africa, in America, in India. So they look at all the viruses and then they'll make the vaccine. So the current vaccine that we have, it will not be working for the H3N2, because it was made, these vaccines were made last year. So we'll have to look at the new vaccines that will be made sometime they'll be available sometime in October, November. So as of now, the vaccine that we have now will not be that effective. It may be effective for maybe 30–40% of the patients, but it will not be 100% effective. The next question is about body aches for more than a week. Is this a symptom of H3N2? Now, typically body aches could be a sign of multiple things. It could be any infection. It could be a lack of vitamin D, lack of B12, lack of iron. It could be something else. So, typically with H3N2, it's unlikely for you to have body aches, just body aches alone. You will have high fever, cough, at least fever and cough along with body aches with H3N2. So, it's unlikely it's just if you have body aches alone for a week. It could be other viruses, because like I said, there is multitude of other viruses which can give you similar symptoms. So, you might have been exposed to some other virus, but it's not H3N2, because with H3N2 you will have high fever and you will also have some cold and cough. That seems to be the last question. So, at the end, I just want to reinforce what I told you earlier. If you have one way to prevent this, both COVID and the H3N2, is to one, wear a mask as much as possible. Number two, use a sanitizer as much as possible. Number three, stay away from crowded spaces where it's a restaurant, you're going to a party, any function hall, all those places. Try to stay far away from people, and if you're touching any doorknobs, any surfaces or if you go to the toilets and you're touching the toilet handles and stuff, those are places where you can get infection. So that's one way to avoid. If you develop any high fever with cold, cough, muscle aches, joint pains, body aches, you need to be immediately seen by physician so you can start antiviral medication. And if your symptoms are worsening, make sure you also monitor your oxygenation with a pulse oximeter. Test your heart rate and your oxygen. If those levels are going down, that's a sign that you have a serious infection. It could be pneumonia, it could be dehydration. So you need to be tested, you need to be started on medication. And at home, the most important thing is hydration. Drink a lot of fluids, especially ORS, electrolytes, stuff like this, which is electrolytes, is good to prevent dehydration. Thank you.